Hi everyone, let's talk about some of the questions, Prometric exam questions today. A patient is being admitted in medical unit and has order for fluid restriction of 1400 ml for 24 hours. He is receiving IV medications in 50 ml solution QID. How much fluid should the nurse administer to have the scheduled intake in 24 hours? So what is his medication administration? This is 50 ml of fluid solution QID, that is 4 times in a day, right? So 50 into 4, that is 200 ml. So what is the total intake? Total intake is 1400. So 1400 minus 200, that is 1200 ml is the correct answer. So the answer is 1200 ml. Nurse is preparing an order of amidramine 30 mg POPID. The available check is 50 mg per 5 ml. What is the correct dosage of the medication to be administered? So the available dose is 15 mg in 5 ml. The dose to be given is 30 mg. So 1 mg is equal to 5 ml divided by 15, correct? So that is 0.33. So 30 milligram is equal to that 0.33 times 30. That is what we need, right? So 1 milligram is 0.33 ml. So 30 milligram is equal to 0.33 times 30. That is 9.99 ml. That is 10 ml. So how we can put it in the formula? What is the amount that we have? What is the amount that we have? That is 5 ml. What is the dose in hand? That is 15 milligram. So 5 divided by 15 times dose required. What is the dose required? 30. Yeah, 30 is the dose required. So 5 divided by 15, the dose in hand, 5 ml total amount divided by dose in hand times dose required, that is 30 milligram. That will give you 9.99. That is 10 ml approximately. Going to the next question. A nurse is preparing a medication order of 100 milligram IV stat. The available hydrocortisone is 200 milligram per 5 ml in distilled water dilution, right? Which of the following is the correct dose to be administered? So going back to the same formula, total amount in ml divided by dose in hand times dose required. So what is the amount? 5 ml, right? 5. What is dose in hand? 200 milligrams. So 5 ml by 200 milligram times dose required. What is the dose required? We need 100 milligram IV stat. So 5 divided by 200 times 100, that will give you 2.5 ml. The correct answer is 2.5 ml. Remember this question. These type of questions will be asked in the exam. A nurse is preparing to administer an intravenous infusion of 2000 ml of ringer lactate solution over 12 hours. The administration set has a chamber rate that deliver 15 drops per ml. How many drops per minute should be administered? So the fluid to be administered over 12 hours is 2000 ml, right? 2000 ml for 12 hours. The fluid to be administered for 1 hour is equal to 2000 divided by 12. That is 166.67 ml. This is for hourly rate, right? So what they ask, drops per minute. So we need minutes rate. So you have to divide it by 60 to get the minutes rate. So fluid to be administered in 1 minute is equal to 166.67 divided by 60. That is 2.78 ml per minute. We divide that to 60, then we get the minutes rate. So 1 ml is equal to 15 drops, right? 15 drops per ml. That's what they gave us. So 2.78 into 15 drops is equal to 42 drops per minute. So what is the drops per minute to be administered? That is 42. That is the correct answer. The nurse is preparing to administer infusion of saline 1000 ml over 6 hours. So what is the hourly infusion rate that the nurse needs to infuse in ml per hour? So normal saline to be administered over 6 hours is 1000 ml. That is for 6 hours. So what is in 1 hour? Divide by 6. That is 167 ml per hour. So what is the hourly infusion rate? 167 ml. That is here. The doctor ordered heparin 10,000 units subcutaneous once a day. Standard solution is 40,000 units per ml. How many ml would you be administered? We have a formula, total amount that we have divided by the dose in hand times dose required. So here, what is the dose in hand? That is 1 ml, right? 1 ml. What is uh, uh, the amount is 1. What is dose in hand? That is 40,000. And what is the dose required? 10,000, right? So 1 divided by 40,000 times 10,000. That will give you 0.25 ml. So the correct answer is 0.25. Okay. A nurse checks the medication chart of a patient which has the following order: paracetamol 500 mg PO QID. So what is the meaning of QID? That is 4 times a day. 4 times a day. That is called QID. That is every 6 hours, right? We have 24 hours in a day, so every 6 hourly. During cardiopulmonary resuscitation for a 75-year-old man in the emergency department, the doctor introduced himself as a leader for the CPR. What is the most appropriate leadership style for this situation? So in cardiopulmonary resuscitation, the resuscitation time, what is the type of leadership that we have to follow? Autocratic, because he should be the one controlling everything in the situation. The leader is the one controlling, right? So that is called autocratic leader. Autocratic leader. Democratic leader means he gave everybody the opinion to be heard, right? Everybody has some type of control. That is called democratic. Bureaucratic and laissez-faire means the leader who doesn't care anything, like he doesn't really manage. Everybody is in control of the whole situation. That is called laissez-faire leadership style. So autocratic is the one who is full control of his leadership style. So in cardiopulmonary resuscitation, the one that he should have is autocratic leadership. Democratic is everybody has control, right? He has some part of control. A nurse manager is open-minded, listen to team, understand others, makes changes to improve the unit. This type of leadership style is democratic leadership style, right? So she is open-minded, she listened to the team, understand others, and make changes to improve the unit operations and procedures. So this leadership style is democratic leadership style. A nurse manager include staff in decision-making process. That what unit structure is used. So the nurse manager include the staff in the decision-making. What type of unit structure? That is decentralized. If the nurse manager is the only one who take the decision, then that is a centralized decision structure. That is if she is the only one who take the decision, that is called centralized. But here she includes staff in decision making. That is called decentralized structure. A nurse manager is preparing and writing a plan for dealing disaster like code red. Which procedure is the top priority for the nurse manager for the plan? Infection control, staff orientation, patient education, patient reallocation. So when she is writing a disaster plan, it needs to be educated to the staff, right? So what is the first priority? Staff orientation. Otherwise, there is no point of writing the plan. So the priority is staff orientation. Nurse manager was not happy about low results of patient survey. Which of the following is the first step for the nurse manager? So the nurse manager is not happy about the patient survey. So what she should do? Schedule a meeting with staff? No. Start changes to improve? No. Review the evaluation results. So she should find out what was the way of conducting the survey, patient survey. What was the question, how it was conducted, and what was wrong in it. So she should evaluate the details, correct? Nurse manager assigns tasks to a nurse according to their clinical competencies. Which of the following management function is this? So she is assigning some of the tasks to their clinical competencies to another nurse. And a nurse manager is assigning some of the tasks to the junior staff. So what type of function is this? Delegating, evaluating, planning, and controlling. So the correct answer is delegating. She is giving some tasks to the staff, right? A post-operative patient who underwent an abdominal procedure. She requests a pain medication from the nurse, and the rates and the pain score at the level of 9. There is a standing order for narcotic administration. When the nurse opens the narcotic cupboard she performs a count, the nurse finds out that the pills in what in the box is different from the pills that was recorded in the sheet. So what is her most appropriate initial action? So what she found in the narcotic cabinet is different from what is recorded. What is her first action to be done? Notify the nursing supervisor, write the finding on the narcotic sheet, administer the patient's requested medication, identify the last nurse who used the narcotic box. So these are none of her scope of practice. Her scope of practice is she should notify the nursing supervisor or charge nurse or manager of that unit. A 81-year-old bedridden patient in the geriatric ward was pyretic. Antipyretic medication was administered via nasogastric tube. After an hour, on assessment, the patient is in deep sleep. His breathing pattern changed, so his breathing pattern reduced, and he did not respond by calling his name. Which of the following should be the immediate action? Call the physician to examine the patient, check for the correct dosage given, check vitals and inform the physician, and try to wake the patient. So when you choose the answer, you should look into which is the appropriate one, and then you should choose one, correct? The most appropriate. So here the most appropriate one is check vital signs and inform the physician. The nurse in the medical unit took a signature on the consent form for a patient who needs an abdominal CT with contrast. What is the best nursing practice? Consent should be taken after the procedure. Verbal consent is acceptable for this procedure. Consent should be taken from the patient's relative. Consent should be taken according to the organization's policy and procedures. So the correct answer is maybe in some organization doesn't need a consent, some organization need a consent, so we don't know. So this consent should be taken according to the organization policies and procedures. In the hospital digital dashboard, what type of data is displayed? Staffing, financial, performance, and knowledge based. So in the hospital digital dashboard, the performance measures like what is the false rate, what is the medication administration rate, what is their what is the things that they are performing well, what the things that they need improvement. So that performance data needs to be displayed in the hospital digital dashboard. A nurse is showing stress and anxiety due to long duty hours. Which of the following should the nurse manager do? So she is stressed due to the long duty hours. So she needs a little bit of rest, right? So give a day off, give light task, offer vacation, talk about coping. So what is the appropriate answer here? Give a day off. A new nursing director is assigned to a hospital. What is the first thing that she should do? So she evaluate the staff, change the head nurse, change the roles, nothing to do. So nothing to do is not correct. Change the roles is not correct also. Change the head nurse is also not correct. So what is the correct one? Evaluate the staff. Sometimes the answer may be confusing. Then you exclude which one is not appropriate. And then you may have one or two options and then you find it from the correct option. A surgeon instructs the nurse to serve as a witness in an elderly patient's informed consent for surgery. During the explanation to the patient, it becomes clear that the patient is confused and does not understand the procedure, but reluctantly sign the consent form. The nurse should, so the patient is confused and he reluctantly signed the consent form. What is the nurse? Nurse also need to sign in that paper as a witness. So what is the nurse action? So she should sign form as a witness, making a notation that the patient did not appear to understand, or she should not sign and witness and notify the nursing supervisor, not sign the form and answer the patient's question after the surgeon leave the room. So which is the appropriate answer? This is not appropriate at all. Not sign the form and answer the patient question after the surgeon leave, also not appropriate. So she shouldn't sign and she should notify this to the nursing supervisor. A Community nurse assigned to work in Makkah, one of the most multicultural cities in Saudi Arabia, and has to interact with multicultural population every day. What is the most important step the nurse should do before interacting with the clients? So the correct answer is conducting an appropriate culturological assessment, right? Asking the patient his cultural background, ensuring that the client has his privacy, looking at the client's file to take history. So these are not appropriate. So this is the appropriate answer. The head nurse meets the staff nurse to discuss ways to improve communication among shift. Which of the following statement best exemplifies the final stage of conflict management? We need to clearly define the nature of the conflict. I will evaluate the outcome of the strategies a month later. Let us create a timeline in the implementation of our strategies. I have to force you to follow the rules to resolve the issue. So what is the correct answer? So here the head nurse is meeting with the staff to discuss the ways to improve communication among shift, right? So she is discussing the ways to improve the communication among shift. So here there may be some conflict, but that is not the correct answer. What the correct one? She should evaluate the outcome of the strategies after a month. The head nurse of a coronary care unit would like to delegate few tasks to a senior nurse in that unit. What initial step must the head nurse implement before? So, checking the hospital policies for delegating tasks. That is the first thing that she should do, because she is delegating some of her tasks to the senior nurse. Is that allowed in that particular hospital? Which tasks she can delegate? So, these things she should know. Explain the task to the senior nurse. Negotiate with the senior nurse. Take the signature of the senior nurse. So these are not appropriate answer. The correct one is she should find out the hospital policies prior to delegating the staff. What must be known on legal points of delegation when processed to a new nurse? Institution definition of job description of delegate. For example, the nurse manager is delegating the responsibility to a staff nurse. She should understand the staff nurse's job functions. Is it allowed? So institution definition of job description of delegate, that is the correct answer. The nursing director wants to evaluate the quality of nursing care at the inpatient area. The management team will evaluate on quarterly basis the documentation and the relationship between the patient's length of stay and the quality of care. Which of the following is the most important data source to identify the quality of care? So here evaluate the nursing care in inpatient area, correct? So how they can identify patients' complaints and time taken to resolve them, patient satisfaction level at the time of discharge, and details of nursing notes for patient progress. So here we are evaluating the nursing care. So that is directly related to patient satisfaction, right? So this is the one that we need to evaluate. The nurse manager received complaints from some nursing to improper work distribution and discrimination. How should the nurse manager handle this situation? So she should investigate the complaints, individual counseling, identify list of problem, continue to observe. Those things will come later. So the first thing she should do is to investigate the complaint. Which of the following is the most appropriate action for a head nurse starting at a new hospital? Make immediate change of all at the unit. That is not the correct one. Plan and coordinate new strategies. Assess unit activities for at least 3 months. 3 months is a long period of time for a head nurse. Ask about the previous head nurse managerial style. She has nothing to do with the previous manager because this is a new manager. She is going to start as a new. So what is her first thing to do? Plan and coordinate new strategies. After teaching the deep breathing and coughing exercise to a patient undergoing surgery, the nurse asked demonstration and helped him in correcting. What part of therapeutic communication is used? Here answer is evaluation, not intervention, not identification or demonstration, because she already demonstrated and she helped him in correcting, right? So it is a evaluation. The intensive care unit nurse manager plans to delegate a nurse. What is indicated for a successful delegation? So the nurse manager supervises the nurse. Nurse has authority to change the task. Nurse manager check task sometimes. Nurse manager asks another nurse to check task. So here we have to exclude the items. Nurse manager asks another nurse to check. That is not correct. She is going to delegate. Check the task sometimes. If sometimes she may not go through everything, right? Nurse has authority to change the task. That's also not correct. So the nurse manager has to supervise the nurse and make sure she understands the functions that she is going to take over before she fully take over. So the nurse manager supervises the nurse before she delegate. So what is the indicator for a successful delegation? She should supervise the nurse how she performed the task well or not. The head nurse of a coronary care unit delegated the staff, a senior nurse in that unit. What initial step must the head nurse implement before delegation? So we already discussed this question. We have to check the hospital policies for delegating the task prior to giving this to the staff. Thank you and see you in the next session. If you like it, subscribe it and share it, and subscribe it so that you will see in the next, you will receive the next lessons.